Welcome to our very first 2021 weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. I have Ms. Susan Masona here on the sign language desk with me. In today's update, I would like to focus on 4 key areas. Number 1, on the science of the epidemiological reasons behind the lockdown. Several people have asked about this. Number 2, we want to clarify or clarifications on some key issues that some have raised on the lockdown, including plans on management of the COVID surge for maximum impact. Number 3, what you and I can do during the lockdown and beyond to control the surge in cases. In other words, how can we as individuals and communities take ownership, collaborate with government, play our part to help curb the spread of this virus. And of course, finally, number 4, what exactly is the nation's surge response strategy? What are some of the planned main activities designed to help urgently manage the surge in cases and hence drive the nation's COVID-19 response back on track for the final push? But first, let us have a recap of our COVID-19 numbers. The year 2020 closed on a very difficult note, with the COVID-19 pandemic raging on more than ever. By the end of the year, over 86 million COVID-19 cases had been reported globally by WHO. The highest number of cases was recorded in the Americas and European regions. As of the 1st of January 2021, the top 3 countries with the highest burden of COVID-19 in the Africa region were South Africa, Morocco, and Egypt. South Africa, of course, accounted for about 56% of all the recorded cases in the Africa region. By the end of Thursday, 7 January 2021, Zimbabwe had recorded over 17,000 confirmed COVID-19 cases, over 12,000 recoveries, and 431 deaths. The country also experienced a large spike in cases over the Christmas and New Year period, that is from 1 November 2020 to 1 January 2021, with approximately 3,000 cases and 60 deaths recorded during just that 2-week period. Whilst Harare and Bulawayo metropolitan provinces have recorded the highest burden of disease of more than 150 per 100,000 population each, the total number of new cases for each of all the other provinces have also gone up considerably. And so the statistics I have just described, explained, are some of the basic data or science behind our recently announced stiff lockdown. Just again, before the festive season, the WHO, in its global COVID-19 situation update, it announced new science or guidelines on how countries could select, implement, and adjusted public health and social measures in line with the various country epidemic situations faced on the ground. Zimbabwe, of course, as mentioned in my last update, was already implementing most of these recommended measures. The record increase in new cases per day during the festive season, coupled with the non-adherence to recommended preventative measures by us and the communities, as evidenced by the large and illegal super spreader gatherings, such as the one held in Mbare on New Year's Eve, culminated in the need for the nation to introduce stiff lockdown. Many of you have welcomed the lockdown strategy because we understand that it is designed to urgently stop or curb the spread of the virus. Some, of course, among ourselves have, however, not understood this and have therefore, and rightfully so, asked questions. Some have gone on to even suggest additional alternative approaches. That's also welcome. These suggestions, as I've said already, have really been welcome. First, a suggestion has come on the need for government to identify provincial hotspots and hence come up with tailored measures. This is a very welcome suggestion. The COVID-19 situational reports published, or rather the national report published by the Ministry of Health on a daily basis, is an aggregation of provincial reports that do show provincial hotspots. Our current data, as I have explained, is showing that COVID-19 transmission is taking place in every province. Efforts to strengthen data collection, analysis, and use of that data at provincial and other local levels is therefore being prioritized as part of the surge-specific response plan during this lockdown and beyond. This takes me to the next issue that some have asked. And this is, does government have proper COVID-19 response plans, or does government simply react to situations? The national COVID-19 response is guided by a very, very clear and detailed, documented preparedness and response plan that was put in place at the very beginning of the pandemic and launched by His Excellency. Based on this strategic plan, detailed operational plans are developed and revised or revisited from time to time, guided by the situation on the ground. The spike in cases during the festive season is one such situation that informed the government to revisit existing plans and come up with surge-specific response plans. Number 3, do we have robust social safety nets to support the vulnerable populations during the lockdown? This is another question asked. The social safety nets that were put in place at the beginning of the pandemic are being revised. They're still very much in place so that they can be continued. These included the cash transfer for those who lost income due to COVID-19, the food mitigation program, as well as the child protection programs. These are strong and running and will simply be strengthened. The Ministry of Labor and Social Welfare, which leads the COVID-19 Task Force Subcommittee on this particular issue, is finalizing detailed surge-specific plans on this issue once again to be implemented during the lockdown and of course beyond. So what exactly is Zimbabwe's surge strategy, and what are some of the priority activities for the national COVID-19 surge-specific response plan? The first and main surge response strategy, and I want to repeat, the main surge response strategy is to focus on curbing the spread of the virus. The recently introduced stiff lockdown is a key and part of this main strategy. In addition, existing social measures or strategies to curb the spread of the virus remain the nation's priority. These, of course, include mandatory wearing of face masks, as we have talked about before, social distancing, washing of hands with soap and running water, and sanitizing with alcohol-based sanitizers. The second main surge response strategy is to enhance surge capacities for the 8 key public health pillars of the national response plan that I mentioned earlier, but focusing on prioritizing a blitz on COVID-19 risk communication with the aim of enabling you, the communities, us together, to take ownership of the response. Strengthening surveillance surge capacities for early detection and isolation of cases is the next priority. Strengthening management of points of entry is also a priority as part of our strategy. Strengthening healthcare workers' surge to health facilities that are admitting and managing severe and critically ill COVID-19 patients, and ensuring that infection prevention and control measures are firmly in place in those institutions is another priority that we're looking at as part of our strategy. So finally, key point number 4 for today's update. What is it that you need to do during this lockdown and beyond in order to arrest the spread of this virus? You must adhere to all the recommended preventative measures. I want to repeat, you must adhere to all the recommended preventative measures, such as wearing of a face mask properly, of course, washing hands with soap and running water, and social distancing. These remain in place. They just need to be adhered to. This is the best way of curbing the spread of this deadly virus and indeed of managing this recent surge. During this lockdown period, I urge you to please stay at home unless you have to go out, attend to an essential service such as getting food or getting to a medical facility for treatment. Thank you.